So we used to trial it out. We did one like A/B testing. You do that with your video. Okay, so we had 2 ads that ran on Facebook for around the women's mini marathon in Dublin that happens. Okay, so you could run it around a park run thing or anything like that. The first ad said free foot scan, and we used to use an RS foot scan and penny picture free foot scan. Get ready for the mini marathon.
Yeah.
Guess how many people signed up? None.
Really?
And the next ad said, want to know how to run the mini marathon without completely dying? 173 sign-ups.
Oh.
Words in a different order. So if you try to sell that, get a foot scan and find out about your foot problem. Bullshit. Nothing. Want to run the mini marathon without completely dying? Of course you do.
Yeah.
Words in a different way.
Mm-hmm.
This is the Justin Blake podcast experience for health professionals that mean business. So wherever you are in the world, listen as we discuss everything you need for you and your health business to survive and thrive. Thanks for listening.
We're here. Good afternoon, everybody.
Good afternoon,
Friday.
sir.
Already. Ektaa, how are you?
I'm good. How are you?
Excellent. All for the grab.
All for the gram.
Yeah. Good. How was your lecture this morning that you did in your Jimmy Jammers?
It was fantastic. I think it was even better because I did it in my pajamas. And we were talking about Charcot foot, we were talking about diabetic foot, we were talking about acute Charcot foot. And then we were talking about more vascular disease stuff. So I was going to ask you, have you...
Charcot all vascular? Give me a refresher.
Oh, it's too early for that. I was actually going to ask you, have you seen a lot of
you don't remember what it is.
I knew you were going to rinse me. The minute I mentioned my lecture, I knew you were going to rinse me for it.
It's ischemia of the blood supply into the bone, isn't it? Yeah, you don't want to get it. I hope So my friend Adrian, who was in A&E or in hello Adrian, he was in ITU in Brighton. He had a complete diabetic crash. He didn't know he was diabetic. So they've already teed him up for losing bits of feet and stuff.
So how did they miss that? Like, was there not a multidisciplinary team working with him, or he just had no idea he was diabetic?
The latter.
He had no idea he was diabetic. How is that possible?
No, he's a bloke. What do you mean it's impossible? Explain to me how it's impossible.
That's hilarious.
How is it impossible? So what happened was, go on.
I just figured that with diabetic feet, you would at least know to some degree if you've got diabetes.
Sorry, I didn't explain it right. He's not in the hospital with Charcot foot. He's in Charcot because he had a diabetic crisis and he ended up passing out on the floor and nearly fitting. He was admitted with a diabetic, he didn't know he was diabetic. He's chronic underlying diabetes. Apparently all his kidneys have checked out. I've known Adrian for 30 years. I find that hard to believe. And his liver and everything else is perfect. So he hasn't managed to screw too much up. But he reached a tipping point in the last couple of weeks where he decided to lose some weight and decided to go on a no sugar diet.
Okay.
So you can imagine what happened over 2-3 weeks. Felt worse and worse. Of course, he didn't want to go to the doctor. Are you mad?
Oh, we've got our first comment.
Yeah, here we go. Anyway, the haters. So let's talk about haters and why you're not on TikTok.
Hi, Gemma. Gemma says, if you have no experience of diabetes, you wouldn't know it's developed. This is actually a really good point Gemma's just made. And yeah,
so he's back home now. He got back home yesterday after 4 or 5 days in insulin for life. Feels a lot better. as soon as excuse me, as soon as I gave him some sugar, he was right as rain. Although his arm pin cushion, he's all bruised and everything. Anyway, it saved his life. Yeah, so he'll get better soon. He lives in Brighton.
How old is he, if you don't mind me asking?
Adrian's in early 52, 53, I think.
Okay, is that usually, that's what, type 2 diabetes, I'm assuming then?
No, he's type 1. He's insulin now. Well, he's type 2, but he's going to be insulin for. But he wasn't born with it. He doesn't have. He's just managed to screw up his islets of Langerhans. Do you remember those?
Oh, no.
No, that's where it's been produced. Come on, what are they teaching you? Anyway, we'll get on to how.
It's not. I don't think this is reflective of like my tutors, because my tutors are doing such an amazing job. I think it's more reflective of my knowledge base, which is zero. So I don't think this is like anything to do with my tutors.
Okay, just hold for a second, because you're all glitchy. So maybe it might be me. It's me. No, it's not. It's you. You're frozen. Dear. Oh, we love technical problems on a Friday. Well, you're back.
It's great. Okay. Right. So I wanted to ask you, I had a list of questions prepared for you. And let's get into the first one. So how did you get into podiatry?
This is not the way this works.
Oh, okay.
What's the question?
So how did you get into podiatry?
The glamour and the money. Next question.
Right. How do you think podiatry differs from Ireland to England? Have you noticed any major significant differences between both?
No. Majority of people who work here currently would have trained in the UK because there wasn't a podiatry school here until about 10, 12, 14 years ago, I think now. Some people trained in the north of Ireland, but majority went to the UK like I did and then came back.
Okay. So just out of curiosity, did you have, if podiatry was established 10 years ago, did you have prior to that nurses that were looking after feet necessarily? Or if anybody had a foot problem in Ireland, where would they go? What would happen?
They go to the podiatrist, because they all trained in England since the 1950s and 60s and 70s.
Okay. So when did podiatry when was podiatry...
the school started in Galway, I think about 13 or 14 years ago, 12 years ago. I can't really remember. Somebody will tell us. There was podiatry service, just you had to go away. Same way as there's no podiatry school, chiropody schools in Canada, and that's why you're in Nottingham now this afternoon, Ektaa.
I'm in Northampton, sorry.
You're Northampton?
Yeah.
Are you in lockdown yet?
Not necessarily. I don't think we are going into lockdown soon, but before I shouldn't really say anything in case I jinx it.
Okay. It's so where were we? Anyway, have you got more questions?
Yeah, I do. I have a list of questions for you. What's your best advice for podiatry students?
Best advice for podiatry students. Ask plenty of questions. Try and get quite good placements, or it's always good that you're going to get some value out of that. I had a couple of quite good placements, but it's good placements is where you're going to get most experience from.
Mm-hmm. And what kind of learning outcomes should we kind of set? What kind of goals should we set for ourselves when we're going into placements?
Obviously you've got quite a lot of stuff going on in the background anyway, with lectures and exams and different things. So the workload can be quite high. But I mean, there's so much other information out there on places like Podiatry Arena and all the different sort of, there's just a wealth of whatever you're interested in already out there. So you can sort of, but I'm sure, the workload's quite high anyway. About 15 hours a week in your pajamas. It must be tough.
It's a hard life, what can I tell you?
when I first got my offer to go to the London Foot Hospital, which doesn't exist anymore, I was with a dentist, and I was like, what does clinical dress mean? and he was like second year medic dentist, and he was like, that means you wear white coat and blow a lot of malarkey. So I was at college with guys who were doing history of art, doing like 12 hours a week. And of course, then you had the pedagogry syllabus, so you've got the lectures plus then the practical side of things. So you were there for every day, apart from Wednesday afternoon when you got to play rugby.
Do you like rugby? Is that your favorite sport?
It's one of them.
What's your favorite? Is it tennis?
Sport, it has become. Rugby, definitely. I've been all over the world to watch rugby. I've played rugby. We had season tickets for Ulster, which are one of the Ulster provinces. I go to Ireland games. I go to my kids' games. I go to my friends' games. Yeah, I do a lot of rugby. Well, it was the interesting thing was we talked about yesterday. I mean, Australia played New Zealand last week in Wellington. Did you see it? 50,000 people in the stadium. No social.
Wait. What happened to the virus? What happened to the pandemic?
What pandemic? Doesn't exist in New Zealand. They have rugby now. They're playing again this weekend.
Okay, fair enough.
You got the stadium, and it's quite good because there's yellow seats in the stadium, and you can see there's no social distancing happening.
All the power to them, then, I guess.
They're playing again this weekend, so I don't know what's going on. Ektaa, it's a bit odd.
Certainly.
Tell me why, if you live, my brother, people are sick, listen to this. My brother's just been back for his 2 weeks ago for his checkup for a tooth implant he had done in Copenhagen a week or two after April. When he went in April, it was business as normal. When he went back for his checkup, it's business as normal. The economy hasn't been crashed. Nobody's lost their jobs, and it's normal.
Interesting.
It's normal in New Zealand. I don't know what's going on here. So anyway, TikTok.
I can't really make an educated comment on that. Right, TikTok.
TikTok. Why aren't you on TikTok? Because your stuff's really set up for TikTok. And the haters, because I thought that first question was a hater question. You have no experience of diabetes. And then I read it.
Oh, no, Gemma. No, she's a sweetheart. Don't you dare say that about her. She's golden. She's golden. She's one of my classmates, and she's not got a hater bone in her body, let me tell you.
Well, you have had some haters recently.
I wouldn't say some. I think I've just had one comment that was a bit like meh, and it's kind of funny because like when I ask for advice for like how to deal with stuff like this, because I've not really dealt with any kind of hate in a professional context. So when I reached out to my tutors and even like other professionals in the field about how to deal with difficult comments, they said, kind of rise above it. Don't really entertain it. And I think initially it is hard not to entertain something like that because you really want to just get your hands dirty and then kind of, throw some mud back. But at the end of the day, I think I do agree. Like it's once the steam is kind of blown over, it's not really, I feel kind of terrible by having engaged in the first place.
Let me just stop you there because it's chopping and chopping and chopping. Have you got other devices switched on, or can you like do something? Because you've just frozen again and it's all really crap. Sorry. Have you got anything else switched on there that doesn't need to be on? No?
No, not from my end.
Okay, well, we'll go again. Sorry. I missed all that.
Right. What was the last thing you heard?
Don't know. Anyway, I sent you something about Gary Vee, who told you if somebody sits down and actually makes a negative comment about you, how shit is their life that want to like, try and, knock somebody else down, which is true.
And I guess it's really easy for us to kind of get a little bit.
Sorry, just can't hear you. Do you want to like log out, please? Because this isn't good. Friday afternoons haven't been good for broadcasts for whatever reason. So I'm going to remove you for a second, and then I want you to log back in, log or restart or whatever, and I'll keep talking. Because
is that better?
Yeah, Yeah, we had the same problem with Sean a couple of weeks ago on the Friday afternoon. It must be just Friday afternoon broadband.
Could be.
Haters.
Yes.
Not haters. Commenters.
I guess because I can kind of understand like where they're coming from, because I'm making silly videos and I'm essentially kind of poking fun at the profession, telling it to like lighten up a little bit. And so I can see why if someone takes this profession as their pride and joy and takes it so seriously and holds it up to a different standard, I can see why somebody like me can come across as offensive to them. But at the same time, I've put a lot of work into my content and I'm proud of it myself. So I can kind of see both sides of it. And it's taken me a while. Like initially I didn't.
Who are you to say the profession should lighten up? Huh? What do you mean lighten up?
How dare you? Burn her.
What does lighten up mean?
I don't know. I think it's taken me a minute to like get to this point, because initially like I felt really like justified in my content, and I felt really like precious about it. But at the end of the day, like none of this in the end matters. As long as like people get a little bit more educated on what the profession is. And to be fair, like I don't want to highlight the fact that the profession can be a bit crabs in the bucket kind of mentality. I really don't want that to be public knowledge, even though I've just said it out loud. But I would rather people see like podiatry can be a very close-knit, positive community. But we have to make it all work. I can't just sit here and say it.
And do you see that then as quite crabs in it? Because your mum's a podiatrist as well. So you mean it's not though you're like wet behind the ears and you don't know what you're talking about. You've grown up with this.
I have, yeah. To be fair, I didn't really pay attention to, although I grew up in my mom's clinic because she was a single parent raising me. So she essentially raised me in her clinics. I didn't pay any attention. Like I had zero interest in what my mom was doing.
Were you doing the cash book and the sweeping up and the meet and greet and stuff?
Yeah, that's exactly what I did.
Still didn't put you up?
No, actually, no, because like my mom had a shoe store attached to her clinic, and she referred all these like shoes that patients could buy alongside with their orthotics. And so I was in charge of like selling the shoes, and that was a lot of fun for me. So I wasn't really interested in the podiatry side. I was more interested in like the sales side and the business side of like what my mom was doing. But at the end, I was very young. I was very, very immature. I still am immature, very naive, still very naive at 28. And I should have paid more attention to what my mom was doing, because it's applicable now in my life. It wasn't applicable when I was younger. But to be fair, like a lot of these like sales skills helped me get jobs as like when I was in university, working alongside being a waitress at the same time and working side by side. So the sales part of it came in very, very handy, and my people skills were honed in my mom's clinic. So that was good. But podiatry skills, forget it. Yeah. I was out of there.
Podiatry wasn't your first degree.
No. And so I really wanted to do law. I wanted to be a lawyer. I wanted to be this like, tough lawyer lady. I don't have a tough bone in my body, let me tell you. So, law was not the option for me. And my mom, she always wanted me to do podiatry. She always wanted me to follow her footsteps. And I was like, no, I'm going to be independent. I'm going to do whatever I want to do. Didn't listen. Again, very hard-headed, a typical hard-headed, rebellious teenager that does not listen to parents, even though she sees her parent working really hard. So it's kind of like a combination of that. Mm-hmm. But my mom's very proud of me now. At least I hope.
Yeah, you still got to pass those exams. You're not going to do that in your jammies.
I could.
You got more questions for me? I was starting to enjoy your questions.
Oh, thank you. I've got some silly questions lined up if you want to entertain some of those.
Yeah, go on.
Okay, so my first silly question is, would you rather be a tree or have to live in a tree for the rest of your life?
Be a tree.
For the rest of your life?
Yeah.
Okay. Can I ask why?
Yeah, have you seen some of the magnificent species or specimens of trees here? I've got a tree in my old garden, like 120 years of age. It's trees are like gives you shade,
So wait, that's a little bit arrogant of you to assume you'd be a magnificent tree. I'm joking.
You wouldn't come back as you don't want to come back as a, I don't know, beech tree. There you go.
Oh, there you go. So my next question is, would you rather be without elbows or be without knees?
Elbows, probably. And then they wouldn't be able to pick the nose. I don't know.
That's a good thing. Would you rather always take a cold shower or sleep an hour less?
I do take cold showers. Because you've seen some of my sea swimming as well, although it's not very chilly. I started taking cold showers when we went on. I do a bit of sailing. Don't you know? Are you coming sailing with us next year?
I get seasick.
Sailing again.
I don't.
No, you'd be grand. Tablets.
I'm gonna be all green face throwing up on the side. You're gonna want to kick me overboard.
No. I sailed once with a Jewish guy while I was holding his ankles over the side, and he was calling for Jesus. I was questioning his religious beliefs. Anyway, when you go on the Navy course and they teach you about how not to die on a boat, actually you do die on the boat, you stay on the boat. They advise you to take cold water showers because if you do fall into the water, you can help yourself to be more accustomed to the cold water shock.
Oh, okay.
Cold water shock is when you fall off a boat and hit the water, and then your initial Steve Darnaswell doesn't want to hear me talk about sailing anymore. Cold water shock is when you go into the water and your initial reaction is to breathe in. And if your head's under the water and you breathe in, you're pretty screwed. So my normal showers tend to finish off with a couple of minutes of just like, here it comes, and just turn it down in cold showers. And I've been cold water swimming as well.
Okay. Right. So next question we've got. Would you rather always wear earplugs or a nose plug? I think I would always wear a nose plug.
Earplugs.
Why is that?
Why is that? Well, smell's pretty important with taste and everything else. So I think smell's a lot more important. And even if you don't have any hearing, you still feel vibration and things.
Mm. Okay, good answer. That's a good answer. Last question. Would you rather always have to sneeze, but you can't, or have something stuck in your eye for a year? These questions have nothing to do with podiatry, and I'm kind of happy about that.
Do you know who Jim O'Fixit is?
Hey?
Maybe I shouldn't talk about him. Anyway, there was a girl once who hiccuped for about a year and a half and had to go to some Swiss clinic who was hiccuping. Do you ever hear about that?
No.
So this was years ago. Nearly sneezing, or what was the other one? Have something stuck in your eye for a year.
Yeah.
I don't
really
know.
hard-hitting questions.
Nearly having to nearly be in the verge of sneezing is quite annoying at times. I don't know. We'll say sneezing.
Okay. Well, we've got a few comments on the live, which I don't know how to access.
Like everyone needs to laugh. Like Emily says, you can hear you loud and clear. Son says you're a breath of fresh air. And Celtic CMR says, look, we're getting round to the sailing.
Oh, I've got a good question from Gemma. Hold on. She said, what's the one thing you wish you were told before starting podiatry?
fun thing was told,
Yes.
don't do it. Do something else. No.
Okay.
No, definitely. No, it's been great. I mean, like I've said before, I've had quite a few careers within the podiatry career, between sports stuff and like skiing things and rehab and foot mobilization, and then building businesses out of it. So
what was your favorite aspect?
I loved it all, but it's all the continual journey to try and fix people better. That's what it's all about, because if we figured it out in the first year or two, it'd just be sitting there doing the same old shit that some people are doing that hasn't evolved in the last 20, 30 years. Would have been bored. I get a bit bored quite easily. So I'm like, I like to keep up to, how do I get that better person better? That got them a bit better, That's the eternal journey.
Okay.
That's why. So what I would like to be told was patience. You gotta have patience. You're not going to do it in a week or two.
Yes, I agree. A lot of patience. A lot of patience with yourself as well. I think that's important as a student.
Yeah.
So I've got a brain teaser question for you. This is a really tough one. Are you ready?
Yep.
So we're doing our protocols for in preparation for our dissertation year. So next year we're doing our dissertation. This year we're kind of doing the protocols for it. If you had to pick a research topic just right off the top of your head, what area?
Manual therapy.
What?
Manual therapy.
Okay. Do you want to talk a little bit about that? What is that?
So manual therapy is hands-on, whatever you're going to do with stuff. So David Cashley is just about to produce or publish his research on manipulation and neuromas and how manipulating a joint has fantastic. It's far, is a better treatment modality than injections or insoles or any other surgeries and all sorts of stuff. And all you got to do is basically click the joint, the metatarsal head. That was it. So we need more of that, because when I first started doing a little bit of foot mobilization with Ted in Australia and brought it back and sort of ran with it here, and again, completely changed how I ran my practice, and other colleagues were like, what are you doing? You're going backwards. This isn't progressing the profession. This is pulling it backwards.
Okay.
Hi, everybody in MSK UK. Apparently, I haven't been... Well, maybe you shouldn't say. Anyway, they were learning too much from me about April and May time, so they decided to not take any of my posts anymore. Apparently, they were bored learning so much. Who knew? Anyway, they were like, "You're retrograde. You're going backward." And my quip was like, when man first got a bit of a sore foot or a leg or something, he didn't reach for a force-plate goniometer. Give it a rub, and it felt a bit better. Yep.
Liam Jones. Who is that? What is that?
Oh, Liam Jones. No idea. John Preston, Liam Jones. Anyway, don't worry. If you start getting random sexual things,
am I on Tinder? No, thank you.
We had a problem with Twitch, but I sort of altered the feed a couple of weeks ago. Gotta be worried. You gotta be careful with this social media stuff. What's the again? They said it was retrograde and it wasn't progressing the profession and it was going backwards. And look at all our stuff. This must be right. All this stuff that goes bing in the corner and all these scans. This must get a better patient outcome. No, not necessarily. Right. Give it a rub. You'll feel a bit better. Do some rehab. Make it stronger.
So do you think there's a lot of conflict between physiotherapists and podiatrists in the field when it comes to biomechanical assessments?
Physios are streets ahead.
Okay. How do you think that podiatrists can catch up?
Somebody, Gemma says, she's going to take up the whole screen. Because when I've seen a lot more people around that, seems to work wonders. Fascinating stuff. It is. Changed my practice. Yeah, just fix it. I mean, it's easy.
Yeah.
It's not. Well, it is. I mean, And you can. I've got loads of free videos on YouTube about how to manipulate and mobilize and stuff. Oh, I found out something the other day. Was it David Cashley said? Somebody else. When you can measure electromagnetic activity in the body after the brain, it was the talus has the second highest electromagnetic activity in the body by miles.
The talus?
I can't remember. Yeah, can't remember who told me. The center of the universe, the astrogallus.
Right.
That one there.
Yeah.
That important one there. Yeah, apparently it's got the second highest after the brain. Because it's all neural.
But did they say why?
Neural. Pardon?
Did they say why the talus had the most activity after death?
Because it's the second most important thing after your brain. That's why. No idea. It is. I mean, it controls the whole foot function. It controls the whole lower limb function. Yeah. It's pretty important. But it's unfortunately, getting back to your course, it's taught really poorly. Because you've learned about axes and measuring shit and doing all this theoretical bullshit.
Yeah.
You have to have the basic sort of fundamentals. I don't know what your course is like. Some courses are different. Some are streets ahead of others. But getting back to physios own biomechanics here in Ireland because everybody went to the UK and biomechanics is hard and it's difficult. And I'm 2 years out and I haven't a clue. So physios took over biomechanics here. And physios were streets ahead.
Yeah.
And again, physio practice is streets ahead. Did somebody say the other day that ultrasound diagnosis is going to be taught undergraduate at the UK level for physios? Yeah, we're still spending. How many years have you now been there? 2. Have you cut many toenails? How many toenails have you cut?
Because of all the COVID restrictions.
How many routine foot treatments have you done? Is there a routine?
I mean, there's few. Right now, we're looking more at diabetic foot. So
John
what is
disagrees.
John saying?
Hold on, most physios are taught by labs. No, we're not talking about orthotics, Sean. We're talking about manual therapies and musculoskeletal problems. And I think I said before, I mean, I was never taught Murray's test and Lachman's test and all those anterior draw tests and stuff. And when I was first working in a clinic in London with Neve, the physio, I walked in with a guy who's got medial knee pain. She goes, "What tests have you done?" Huh? Right. That was 30 years ago. They're streets ahead. Yeah, left in the dust. But again, that's a lot of that's got down to the fact that there's 30,000 physios in the UK, and there's only 10% of that or 20% of that podiatrists. You don't get as much. In a bigger profession, you get to do more. But all these extended scope practitioner posts and things, physios are taking over. I thought in a lot of health service places where podiatrists getting sidelined. So there may not be streets ahead. I don't know. Liam Jones is potato. Anyway, fucking whatever name. Don't worry. Liam, whoever Liam is, bye. We'll just block him. So when I came back to Ireland, there was no real biomechanics. There was no real podiatry, which was really good for business. Because the physios had a lot of it sort of sewn up, all the orthopods referred to physios because again that physios do their rotations within the NHS sort of ward setting and orthopedics and neurology and things. Where podiatry tends to be external site, not into main hospitals.
So that's really strange. Why is that? Because it's the same in Northampton as well.
That's the way it is in the NHS. The NHS has, on the wards, you have nurses, you have physios, you have OTs, you have dietitians and stuff. They're all part of the hospital team. Now, you will have podiatry supplying into that, but they're not on the ward every day like the physio is, getting somebody up and walking them or doing rehab, or like the dietitian. And so those professions are involved in a day-to-day through the NHS. Before I got blocked as well. So, see what I mean? You're blocked me. She's not giving you her Instagram. She's got a boyfriend who's off to Imola. You didn't even know where Imola was. Tell us why he's off to Imola. Why is he off to Imola?
I think it's Bahrain. He's off to Bahrain at the moment.
Oh, he's lying to you. He was in Bahrain last weekend. He's in Imola in 2 weeks' time. Is he not back from Bahrain yet? That was last weekend.
I don't think that's his necessarily.
Okay, anyway.
He's off to Imola. Why is he off to Imola?
I don't know. I don't really listen. This is so obvious that I'm not listening. The most crucial conversations.
It's part of his job that he's off to Imola because he does what?
He does airbrushing for Formula One cars for Mercedes.
He does. He airbrushes Lewis Hamilton's car to make it go faster.
Sorry, say that again?
He airbrushes Lewis Hamilton's car to make it go faster.
Yes, but unfortunately we can't airbrush Lewis Hamilton's brain. This is the most unfortunate part of all of this. He's such a beautiful man, but so stupid.
He obviously doesn't need his job anymore. Go on, tell us more about Lewis Hamilton's brain. You want to get the sack? Go on, tell us about Lewis Hamilton.
He wouldn't get the sack. I don't know.
Really? Okay.
I think someone needs to separate Lewis Hamilton from his Twitter, or maybe get like a.
I don't follow Hamilton on Twitter. I hardly even watch Formula One anymore. I used to watch a lot of Formula One, but it's okay. Christopher, I don't know what Christopher's title is now. I was just talking to Christopher. He's a Formula One nut, so he still watches a lot.
Okay.
Have you ever seen Grand Prix?
Nope.
Interested in motorsport? Ice fishing's your thing.
No. We're grasping at different stereotypes at the moment. But ice fishing is definitely not my thing.
What did you used to do for fun apart from ice skate in Manitoba?
In Manitoba, nothing. After high school, I just got busy with working part-time jobs and didn't really have enough time for hobbies.
That's what my friends in Toronto said. There's nothing to do in Manitoba. It's very dull.
No, it's very, very dull. Okay.
Here we go. Said, I was taught students all this. I wasn't taught ever any. And guess what? None of the Galway students have ever been taught any, because I've seen them for the last 8-10 years and they never knew nothing. Some places are streets ahead, some others aren't. I think it just depends on the lecturers who are there. But I think I've said before, I think it's the wrong way around. It should be all be biomechanics the first few years and then all the treating of the foot stuff later on, rather than.
I agree with what Sean is saying. I think we need more mentoring with MSK tests. Definitely, that's a really good suggestion. If Sean has any people that he recommends, please put it down in the comments. That would be super appreciated.
Hello, I'm one over here. Have you not been watching what I'm doing for the last 6 months?
If you know anybody else, Sean, put it in the comments. This is a good way to never get invited back again.
That's okay. I thought you were running the show. Well, any more questions?
No, that's all I had. All I had.
Did you like the bee thing that I sent you this morning?
I don't think I looked.
What?
I can take a look at it now. Hold on.
Do you want me to play it for you? Basically, it was on Radio 4. Wait till you hear this. Somebody in Oxford, saw a legal opinion about their next-door neighbour's beehive and whether they would be legally allowed to take a case against their neighbour's bees flying into their garden and taking their nectar and bringing it into another garden and making honey.
People have way too much time on their hands.
Exactly. So you obviously do with all your videos. So why aren't you on TikTok?
You keep asking me and I keep saying I'm not getting it. Anyways, what is Steve saying? Steve, is any of the students scanning yet? Just asking. We have not started scanning at the moment. because we are in smaller rotational groups with our clinics, and we really don't use our lecture rooms at the moment. Is that Emily Haworth? Haworth?
Yeah, Emily
Is that who you mean, Sean?
Yes.
Okay, yeah. These are good suggestions.
Hold on 1 second.
Yep. I have you all to myself now. Gemma, I should get a profit from all that, honey. I like that. How do we highlight that comment? I think I can't do it.
Just talking to one of the guys in the local hotel. So normally they have about 160 over a weekend. So he's got 40 tonight and 60 tomorrow. And weddings have just been reduced down to 20, so 25.
All right. Okay.
What's over here? Sean says Emily Haworth. Yeah. Haworth.
Yeah.
Haworth. Let me look close. Where were we? Checking up on lockdown with the local chef. So they're not going to be busy.
Right.
It's a lot of practices aren't going to be busy either. Don't know why I was smiling. Just sort of thinking of things. Yeah, it's a shit show.
So would you rather have a private practice, or would you rather, if you had to redo all of this, or would you pick another career entirely if you had to go back?
I nearly got to the stage where I went and did an osteopath degree because I was into the manual therapy so much. I think osteopaths are pretty switched on in terms of...
What is that? I don't really know what an osteopath is or does.
They're osteopathic medicine. Again, there is another branch of manual therapy. But I think the only training that I would do now is the anatomy and motion training by Gary Ward. If you want to learn full body biomechanics integrated and how to fix people easily without expensive bits of plastic in shoes and stuff.
Yeah.
And Gary Ward stuff is the only gig in town. Is the only fully integrated body biomechanics. Took me 25 years to find him.
Oh, and is he? What's his profession? What does he do? Gary Ward.
No qualifications at all. None. Used to fit ski boots. He's a ski boot fitter. Again, friends on MSK UK, when he first published his book called What the Foot, were like, who is this guy? Where's his research? He hasn't got it. Really? And they hounded him off social media. And they hounded groups. Oh, yeah. But Gary Ward mechanics in his little finger, mate, than you have ever learned. You want to take a Pepsi challenge? He hates that when I do that. Gary, well, I had a whole interview with him. And after that, I was expecting a whole load of bunch of bananas, pitchforks, and coming round. Guess what?
Yeah.
They still don't understand it. Scapular mechanics, working with thoracic mechanics, working with cervical, working with subtalar and knee. Mm-hmm. Yeah, no, stick a bit of expensive plastic in it, mate. Off you go. Here's a calf stretch. See ya. That's not the game anymore. You want to fix patients, you need to fix. I told you that's what the full body rehab exercise stuff. So Gary Ward was hounded on social media by predatory colleagues who will remain nameless.
Oh, that's terrifying.
It is terrifying for somebody who just, and I guess, of course, they hadn't read the book because it wasn't about it. Hello? It's just called What the Foot. Anyway, What the Foot 2 is coming out, or I think this one's called What the Feet. So Gary, I was talking to him yesterday. He's just doing the finishing touches too. So his course is a full immersion. It's like 5-day course. Which is done.
Yeah.
Blue. It would probably take a year or two just to be working with patients regularly.
Kate Triana, yep. She's in third year right now at Northampton. She's with us.
Yeah.
She's doing her dissertation on duplex scanning and ABPI, which I think is super cool. Catriona, did you want to expand a little bit on that?
Anyway, back to biomechanics. It would probably take a year or so just to get the head around that this needs to happen and the arm needs to rotate out and the shoulder needs to do this for the whole sequence to work. But he's got a whole body map. You just learn the whole body map. And it's individual for each person. So it's not you've been taught that it's 6 degrees here and you need to make it 2 degrees there, because that's bullshit. And if it's still being taught, I've been told that, we can't change the syllabus and this is the way it has to be. And when we talked to Bob Kidd, the anatomist, podiatrist turned anatomist, I mean, there were notes that were taught in the 1950s that they were still being taught in the 1970s. They were still being taught 2 years ago in certain podiatry schools. Just blow dust off them. Well, 1 and 1 always equals 2. Foot mechanics has moved on a lot through different theories with Dannenberg, sagittal plane, and tissue stress and unified theory, all those sort of things that are continuing on. But again, back to it, it's all neural.
So I had a question about that. There's been lots of, so anybody I speak to, basically, any professional I speak to, they have conflicts with the root theory and how it's a little bit problematic. I think maybe Kirby spoke a bit about this. Kevin Kirby. Anyways, what are your thoughts on the root theory?
Heard of them. Yeah. But I mean, think about it. Let's talk about Kirby and a Kirby skive. You know what it is? You want me to do a drawing?
I don't know what that is now.
You're a second year podiatry student. Have you done any biomechanics? What have you learned?
We've done a few reflex tests. We've just started our pediatric orthopedics class, so we've done a few assessments. We haven't practically done any assessments yet, but there are online classes.
Did you do any root biomechanics last year?
I don't think so. No.
You know why a rear foot varus is caused for a lack of derotation of the whatever?
I think we did. Yeah, there's a tutor who covered that, but I think you're asking the wrong girl because I don't really remember too much. I'll be honest.
So with feet problems, okay, as you stand on something or you get an external injury, or you have some type of obviously systemic condition, all foot problems are biomechanical in origin. So what do you mean you're not into it? Ingrown toenails, corns, pains, overuse injuries, bunions, nail deformities. I've said that twice. Diabetic ulcers, Charcot foot.
Okay.
That's all biomechanics. What do you mean you don't into it? You're asking the wrong girl. You don't know it.
No. I didn't. Let me just rephrase. I didn't say I wasn't into it. Let me just clarify. We were taught a little bit, but I don't remember most of it. So I am into it.
Are there advances in podiatry currently you're excited to see play out and would recommend that people look out for? Yes, my new 12-week What the F is all this biomechanics foot course about? That's what you want to be looking out for. No.
Yeah.
It's, just go back. I mean, well, you asked the thing about root, so you just threw out a question about root and you don't know anything about root. So tell me what you learned and what you want to know. Because it is. I mean, it's quite a good way of you bisect here and this moves there and that's that. In the 1960s. But as I say, it's not maths. Everything's moved on. It's changed. We look at things in a different way now. Because, again, have you cast anybody's feet? No. I hope you do, because guess what? The amount of people that I see, 4 people who worked for me over the years never cast a foot. Some people cast 1 foot once. And then they're thrown out into practice. And away you go. And they wonder why they don't know, and they're worried about treating patients. How is that preparing somebody? I think the course is very comprehensive. Okay, don't get me wrong. But I also think that it does not prepare people for. And again, I had a conversation with one of the lecturers who looked after all the placements for all the students. One year will remain nameless. So, in the west of Ireland, what are those 15 people going to do? So 17 people qualified this year. There's 2 health service jobs. What are those other 15 people going to do? Nigel in Galway? Didn't know. Yeah, well, you told me not everybody wants to work in private practice, Justin. Okay, well, what are those 15 people who've just qualified? Where are they going to work? Because they're in any service jobs, so they weren't at that stage. And so if they're not prepared for, they haven't cast, patients, they can't even use I'm not allowed to curse. They can't even use an autoclave, for God's sake. What are you doing, turning people out? Apparently they were shown, but just like you, they've forgotten. We used to have to train people when they came to work for us how to switch on an autoclave, how to sterilize instruments. They were taught, apparently, but they forgot. Yep. Yeah, that is the title, Gemma. It is called What the F is All This Biomechanics Stuff About? Because it's made really hard. How long are you qualified, Gemma? Everybody comes out, they're scratching their head, and what am I going to do? And they don't have any system. They don't have a... Yeah, I've been to a couple of universities which supposedly had sports medicine, did not sports medicine. Yeah, more sport. Yeah, there's more. Yeah, no sport. One of the students in our final year MSK case history final presentation thing. Guess what? The MSK one. Lady was in a wheelchair. That's how MSK it was. I mean, I'm not knocking it, but it needs to change. It needs to prepare people for the new world. And I think that's what definitely is it Plymouth, Portsmouth? Whatever one's the furthest south. That new podiatry apprenticeship scheme.
Right, yeah.
In a practice on the job.
Yeah,
but I do know somebody who applied for it, and because they were a single-handed practice, they weren't eligible. I don't know why. I mean, you could have one of the best single practices. They didn't ask her how long the practice was established or what services she provided and those stuff. And like, oh, no, you're on your own. You can't have them. She could have one of the best practices in the country. They don't know because they didn't ask her. So I'm sure there's different rules. But I think that will be learning on the job, certainly practical aspect of it. I mean, do you want me to explain biomechanics for you in about 5 minutes? It really is that simple. Sure, go ahead. Have you seen a foot? You've heard of the talus. And it just controls the whole of the function of the foot. It's a triplanar movement. You've heard of triplanar. Name your 3 planes.
Transverse, frontal, and sagittal.
There you go. So all the movement normally happens in the sagittal plane. This way. That's sagittal movement. Then there's frontal, is that way. Inversion, eversion, and then transverse. And you get a whole movement. And so pronation is a triplanar movement. And if you can see it, if you have a look at x-rays and weight-bearing x-rays, which is what we did, we were criticised for when we came back from Australia. Like, Justin, how can you be taking x-rays of patients and things? And you shouldn't be doing that, was the feedback that we got from. I was like, what are you talking about? So x-ray, and you can look at positions, and you can see talar position, and you can see anterior shift of talus in the ankle joint. Yeah. So, sorry, who was saying that you can't x-ray? Somebody in the west of Ireland. West of Ireland? Okay. Where the Padre school is. Oh, well, I'm not going to knock at them, but they're there. They're like students. They're like, we shouldn't be doing that. Really? So, wait, the students said it or the lecturers said it? Students went back and were like, oh, we were assessing patients, sending them off having x-rays and looking at x-rays and looking at joint angles and talar positions and intermetatarsal angles. And it was like, all right, who's allowing them to do that? Why are they doing that? You're for real. Get a line. So you sent the patient to go get x-rayed. You weren't actually doing the x-rays. You're not allowed to push the button in Ireland. You need to be a radiographer to expose, or a chiropractor. And so we had clinics within a number of chiropractic clinics because they had x-ray. Yep.
I see. So you got a bit of heat for that.
No, just somebody didn't. No heat. I don't worry about any of that rubbish. So, sorry for improving the profession and pushing things on and pushing on diagnosis and pushing on treatment protocol. We'll just sit around and cut toenails, shall we? You can train a chimp to do that in 2 weeks.
So how do you feel about podiatrists that just do basic foot care, like i.e. cutting toenails, if that's all they want to do?
Sometimes you just need a break. Talk about COVID and lockdown and the holidays that you aren't going on. And sometimes, it was good to have a couple of patients just stuck in. And I mean, I liked it. I mean, the relief and the instant relief that you can give somebody from an ingrown nail or a corn and enucleate it and pad it up and the person skips out. And it makes a huge change to their life and mobility and stuff. It's fantastic.
Yeah. So it is crucial. It is a crucial part of the profession.
It is. Emily says no cursing. Oh, yeah, I won't curse yet, Emily. Don't worry. So no, it's essential. I mean, it is. But I mean, it's. I have to talk about one more. Yeah, it's. Why is that coming back again? Has it got a root? Yeah. So anyway, I like to, but I also like to fix things. So I wanted to know why you were getting it. As I told you, it's all about biomechanics. So back to basic biomechanics. So as the talus moves forward, anteriorly shifts in the ankle joint, it has a whole knock-on effect through the foot.
Yeah.
The medial lateral column. And do you ever see one of those little jointed snakes that kids have? The little snake things? Okay. God, I forgot. You grew up in Canada. Nothing happens there. Here's a little snake in your foot. So you got this talus, pushes it into the navicular, pushes it into the cuneiform, pushes it into the metatarsal. And if you can imagine, that's just and so it can either go, it can either go straight. It's like trains on a train track. They're pushing each other. They can either go straight or else they can go kinked.
Mm-mm.
Okay, so depending on your axis and theoretical whatever route and all this sort of stuff is depending what axis is, depends what way the joints go. So if you get an anterior shift and you have a certain axis, you'll end up with the train tracks pushing straight and you'll end up with a loss of joint space here. And you end up with a hallux limitus.
Mm-hmm.
Yeah. And if the trains push off in another direction, guess what? Where are we? We end up with a bunion because it sticks out there. One train goes that way and one train goes that way.
Right.
That's it. It's all coming from the talus.
Okay.
In the universe with the highest electromagnetic field apart from your brain. But it's all neural. I keep telling you, you're not listening. The readery research to start to read out, is Heidi Havoc, who is a chiropractor in New Zealand. Go on the Heidi site. Heidi is amazing. And she was some podiatrist, not me, maybe you should. Heidi decided a few years ago that if she published her research in the Journal of Chiropractic, nobody would read it. And they would just criticize it. So guess what she did? She went off and she published it in the International Journal of Neuroscience.
Oh.
Yeah. Now she can do whatever that she likes because she rocks. Yeah, because, nobody can go, oh, you're only a chiropractor, you're only a chiropractor journal. International Journal of Neuroscience. Off you go. She's got about 60 articles. She's a rock star. It's neural. It's all neural. The proprioception. Close your eyes. Close your eyes, Ektaa. Come on, put your hand out. Close your eyes, everybody.
Everybody? Okay. If I'm doing it, everybody's got to do it.
Watching.
Okay.
Right? Bring your wrist up, bring your wrist down and move your hand. That's proprioceptive. Mm-hmm. Yeah, you know where you are in spatial, but move your hand and up and down, your individual finger.
Yeah.
The reason to interpret that is because of the pathways through to the central nervous system. So if you get shit in, shit out, like computers. So if you get injury and you get interruption of signal and you've got overaction and tight muscles and things aren't aligned and there's all sorts of physiological stuff going on around the nerves and It's all neural. So what you're actually doing, so anything, acupuncture, reflexology, sticking a needle in, rubbing it, putting an orthotic, which is supposedly a load modifier now, giving somebody exercise, all it does is it changes the neural signals. Hopefully it's going to improve them. It just puts a different stimulus in. Anatomy in motion is where it's at in terms of biomechanics.
Okay. Yeah, that makes sense.
Anyway, Gary's got a new book coming out soon.
Yes. What the feet?
Well, I don't know what it's called, What the Feet. But anyway, you can go back and look at my thing. So some of those haters for Gary, they probably just didn't understand it. They're probably still thinking about, because you were taught that muscles move joints, weren't you? Muscle contracts, pulls the joint. Gary says that's wrong. Gary says joints move, give muscles something to do.
Okay.
Looking at things. I think that's why a lot of the guys with pitchforks are still scratching their head. They're trying to figure that out. From back in April or May when we talked a full hour and a bit for Gary, and he absolutely explained it all. Wasn't about feet.
Yeah.
Just called What the Foot. Anyway, so who knew? It's great. 5-day immersive course. God, it'll take me a year or two to get my head around it.
Okay. But do you feel like you understand it now?
No, didn't do it. I just, what I did was that I worked with other practitioners who used it. My colleagues, Lee Claffey and David McGettigan and Ronnie Ward over in Galway, they're far more switched on than I am. And they're pretty much doing, Lee Claffey's doing full online, all around the world, movement and pain specialism. So is David McGettigan and Ronnie. You do it online. The great thing about musculoskeletal, it's a visual thing.
Okay.
And they've really transitioned from clinical stuff. Anthony closed this complete clinic in Dublin. There's this consults like you. He doesn't wear his Jimmy Jammers. But he...
Why are you hating on my Jimmy Jammers? I love my Jimmy Jammers.
I've got my Jimmy Jammers on here. No.
Have you?
No. He... So
that's some OnlyFans content, Justin. Nothing. Continue.
I did forget one morning in one of the Zoom calls, but I think it was after we'd gone off air with Dave and Kate and Celia. They got a bit of chocolate. But everybody loves consulting, and my mate Jerry, the doctor. Jerry thinks online consulting's brilliant. He'll never go back to how it was. Half of Dublin's moved back to America. All the corporate stuff, Twitter, LinkedIn, Indeed, Google, they've all gone back. They're not going to have to ever come back to Dublin again. Now, Twitter had 7,000, 8,000 people in Dublin, all working from home now for good. Yeah, it's all online. It's a new world. Yeah. So virtual podiatry. Yeah, so that's what one of my colleagues way back in March, all those months ago, was like taking the piss. How do you virtually treat a corn through a screen? Yeah, well, you don't. This year, some of the patient phones up, and you give them proactive advice now until they tide them over, until they can get into the clinic to have it treated.
Yeah,
Mister. Yeah, I'm not allowed to curse. Apparently, I'll have a situation again.
Oh, did you sort out your last situation? Did that work itself? Your last swearing situation?
Oh, that was months ago.
Was it?
That was April.
Okay.
And again, if you listen to the whole thing, there was 40 minutes of me talking about why you ethically need to put your prices up.
Right. And how do you feel? How do you feel about that? You're obviously pro putting your prices up.
Well, I think people are undervalue themselves and undercharge.
So, what do you think a podiatrist should charge? What should our base price be?
Well, that's price fixing, which is illegal.
Oh, okay.
Yeah, although I'm still wondering why, since I moved back to Ireland in 2002, the Dental Society offices in Dublin have been raided 3 times looking for price fixing things. Yeah. Who Who knew? Nobody's gone to jail yet, but they keep turning up and seizing all their files and seizing all their computers. They did it about 18 months, 2 years ago, and nobody's done any time yet. But yes, it's illegal for me to say everybody should charge 80 euros in Ireland, and we should have a meeting about that. And everybody, so on Monday morning, when somebody phones up, every clinic in Ireland, it's 80 euros. That's price fixing, which is illegal. So you don't want to be doing that. Anyway, I would say something around that mark.
80 pounds or 80 euros.
Oh. 80 euros, £75. Yeah.
But if we're charging like a high price, should we at least have like free consultations or?
Yeah, are you not doing that as regular? You used to do all that. Free 15-minute phone consult. You want to chat with a podiatrist? Of course you do. Yeah. Why wouldn't you? No, people don't do that. People always want the dough first. People always want to buy the service first before get the credit card out, and then we'll give you it.
Yeah, that's dodgy. That's very dodgy.
It's not the game anymore. The game is to give away all your good stuff for free, like we're doing now. Look, you just got free biomechanics stuff. You probably only need to run that 12-week course.
Yeah,
it's very simple. Just getting the foot working better. Yeah.
The foot and ankle show is on at the moment, isn't it?
Yeah, I had a look at it this morning. It's just pretty good.
Who's on the roster?
Dave. James,
I know Dave is, yeah.
The Purple Potty Pod.
Oh, yeah. Diane, yeah, she's going to be on there. How do you feel about that? Can I stir some trouble?
Being purple.
I love it. I think she's great.
Yeah, you should find her niche.
Yeah, oh, definitely, yeah. Plus, I love purple. I like the color.
Yeah, big practice from it. I mean, there's a toe bro in Canada. You've met him, have you?
I've not met him, no, but I'm on his YouTube channel. I've subscribed.
Yeah, have you seen this singing dentist?
Oh, yeah. I've seen a few of those.
Yeah, so, I mean, those guys are niching. That's what people need to do. There's too much brand out there. There's too much. I've got this qualification. I'm registered with this thing. And I do a late night on Thursday.
Yeah.
People don't care what your qualifications are or what.
Yeah.
I feel like a stuck record. We talked about this with Sammy yesterday. The last thing somebody needs is another blog on Freiburgs. What they need to know is how I can skip through the leaves in Northampton this weekend, pain-free, in my favorite shoes. So that's what they need to know. The 5 walk I could be doing in Nottingham Forest this weekend if I didn't have foot pain blog. So we used to trial it out. We did one A/B testing. You do that with your video. Okay, so we had 2 ads that ran on Facebook around the women's mini marathon in Dublin that happens. Okay, so you could run it around a park run thing or anything like that. The first ad said free foot scan, and we used to use an RS foot scan and penny picture free foot scan. Get ready for the mini marathon. Yeah. Guess what people signed up? None.
Really?
And the next ad said, want to know how to run the mini marathon without completely dying? 173 sign-ups.
Oh.
Words in a different order. So if you try to sell that, get a foot scan and find out about your foot problem, bullshit. Nothing. Want to run the mini marathon without completely dying? Of course you do.
Yeah.
Words in a different way.
Mm-hmm.
They don't know what a biomechanical assessment is. They don't know what a gait analysis is. Don't know what an orthotic is. Don't know what PRP is. Don't know what an ultrasound is. They don't know how anything works. You're talking Martian.
Mm-hmm. Yeah. So would you say that's an advice that you have for podiatry students is to really make it in plain language? Explain it to your patients in plain language.
It is plain language, but it's also, it's a bit sore. It's a bit stiff. It needs to get a bit freer.
Mm-hmm.
It's a bit stuck.
Is that you?
Yeah. I don't know.
Why are you dinging?
Why does Instagram kick off after an hour? Maybe you can only do it an hour. Anyway, it's a bit stuck I've got to get it freer. It's a bit stiff. It's got to get looser.
Yeah.
It's tight. It needs to be more loose. It's not strong. That's it.
Fair enough. That's really good. Keywords.
It's a bit stiff.
Yeah.
It's a bit tight.
Do you have any
these exercises? Remember that tightness we talked about? That's going to help all that. The reason why they're doing it.
Mm-hmm.
You got to tell the reason. You got to sell it. You got to explain the reason. People are going to want to do it.
Yeah,
you just go, here's some exercise. I don't know what. Yeah. Why is he giving me exercises? What are they for? I don't know what he's talking about.
So how do you feel about treating a patient who is non-compliant? What do you do in that? What do you do in that situation?
Get rid of them. Get rid of them.
Really?
Yeah, I used to kick them out. I used to have a conversation. It was like, 3-4 week review. Not getting any better. Well, you'd missed 2 appointments and you haven't done those exercises like you told me. So I don't think you really give a shit. So see ya. I'll still keep taking your money. In a nice way, really. It'll still keep eating your money. But, you're sort of wasting your time. You told me you told me you wanted to wear your red shoes to go and kick through the leaves when you went away on holiday in November. We put a plan in place for you to do that. I'm keeping my part of the bargain. Remember, we said you got to turn up and you got to do this, you got to do that. I'm going to do this to you. We're going to work together to get it better.
Yeah.
You're not doing that. You're not keeping your part of the bargain. So that's why you're not getting better. So you want to keep going. This is what we need to do. Don't sit there and tell me you're not getting better when you've done all to help it. I'd also get away from this. We're trained to fix people, not fixing shit, mate. We're just helping them get better. Facilitate their improvement. Let me just sort the gram. How do you spell your name again? Don't worry. Hold on. EK. Where is, I did ask you this before a couple of weeks ago. Where's Vadgama from? Where's your history from?
So my lineage is mixed. I'm a mixed Indian and European.
Cool. Student. I can go back and do this later, but if I don't post it now, it'll lose. Shit.
So what are you posting?
We're posting it onto the gram.
Oh, right. Okay, yeah.
It's all for the gram.
All for the gram. Do it for the gram.
I'm not allowed to curse, so I can't say the next line. Yeah.
That's a wise decision.
Well, it went viral on TikTok. So why aren't you TikTok, Ektaa? I'm on TikTok. I've got 4 TikTok channels.
See, you're already on TikTok, so you can reign supreme there.
But my main TikTok channel that has nothing to do with pedadry.
What's your main TikTok channel? What do you do on there?
Well, I've got a pedadry one. I've got a gardening one. I've got a sailing one.
Oh, you do gardening.
Yeah, I've got a polytunnel and grow stuff and everything. Anyway, but the main one is, will you hear this? Can you guess what it is? I review chicken wings.
Oh, I've seen that. You sent me a link to that. That was hilarious.
25,000, 30,000 views. Anybody wants to look at the TikTok, it's called The Wings Man, I think. The Wings Man. Anyway, somebody contacted me on Instagram who'd seen one of the videos because he and his girlfriend like it. And I had to do a personal video because she was 20. Anya, how are you? She was 21 last week. It was quite funny. So, I mean, that's it. I think one of them it got recognized. I did one with my friend Kieran.
Yeah.
And Kieran got recognized in the local town. I got recognized now for like young fellas leaning out of cars going, oh, I ain't done any chicken wings.
I agree, Gemma. I agree.
Ridiculous. Yeah, well, whatever, Gemma. You haven't got 35, 40,000 views on your TikToks, have you?
Relax. No. She means no harm.
But it isn't. I mean, it's not about the views. It's about the twits. Yeah. See, the first one I did, I got like 18,000 views within like 36 hours.
That's really good.
Second one I did, I got 4. So anyway, just looking back, that first one's at 20,000, the second one's at 5, but the most ones that had the most views was And if anybody's going to watch just one, you got to watch the farmer one. And I'm wearing a Jaws t-shirt with the farmer in the background going, "Who trained that winner?" Because it was on Derby Day and the farmer's a bit hard of hearing. Anyway, 63,000. But I get lots of bullshit on this, lots of comments. Will I read you out some?
Sure. Yeah.
Well, I do get recommendations to go. Yeah, one of the guys was like, "Have you drunk 10 pints of Guinness first?" Oh yeah, yeah. And somebody scored me -4,500 because the guy in the restaurant wouldn't come closer with the camera. One of the guys thinks he goes, "You're carrying TikTok, bro," which is good. It's come here. He thinks he is scoring dancing on ice. I've never seen it. Eating etiquette is similar to a dog chewing a wasp. And how does this unqualified judge the qualified? There you go. So lots of stuff. But Kieran was like, he phoned me up. He's going, "I just got recognized in town about 10 miles away. We did a TikTok like 8 hours before. And somebody walked up and goes, "I saw you on the TikTok on chicken wings." There you go. That's going to be the new career, getting sponsored by and running biomechanics courses around the world, which we were supposed to be doing over the last week or two. I was supposed to be in Valencia this week, but that's not happening. So not too sure what's happening. We're all e-learning.
How do you find e-learning?
Gemma couldn't work TikTok. What do you mean, how do you find e-learning? It's really easy. Just press play and take notes. Easy. And like the Foot and Ankle show today, I've dipped in and out of it already. And it's there, and it's a resource. I think it's available for the next 2-3 days. And that's the thing about TikTok. It just opens with the thing. How could you not even work TikTok? I mean, how you work it is you just watch about 6 hours of it, and then you do something. Let's say your stuff is really good for it.
Will see.
We've talked for quite a while. We'll go for a while. But, there's all sorts of stuff on TikTok. It isn't just prepubescent teens dancing. People are doing things.
Well, see, this is why I don't want to get TikTok, because
no, it isn't. Like this guy, there's barbecue stuff. There's a guy fixing brakes on cars. This guy's making an omelette. She's dancing. There's all sorts of things. Gary V's on there. The guy teaching you how to play guitar. There's all sorts of stuff on TikTok. It's just a new social media thing. Yeah. But it's and there's a couple of good podiatrists doing loads of stuff. You see Dr. D, you have Dr. Dana. She's there from California. She's a TikTok star. There is there's I can't remember the name of it. One of the ladies from the practices in the Foot and Ankle show. Just pull it up again. They're on TikTok. They're absolutely killing it. Their TikToks are so funny. They're doing TikTok, making funny TikToks about fungal nails. Who knew?
I love it.
That lady, his name is. So here's the Foot and Ankle. So I can have a walk now and go and have a relax and e-learn off the Foot and Ankle show off my phone. There's Diana, Purple Potty Pod, Dave Dunning, Jonathan Small, Dave James, Love Your Feet, don't know who she is. Martin's on from Firefly. Emma Kiley. No, where's that lady? She was definitely here. Pauline's there. Don't know who he is. Sure she was on it. Anyway, in the exhibition hall, it's quite a good way of doing things. Everything's going online. I mean, the Web Summit, do you know what the Web Summit is? It started off in Ireland a few years ago, like a couple of hundred people. It's like, it's one of the biggest media web things in the world. It's run out of Portugal this year, but it's on in December. Okay. It's going to be completely virtual as well. So, Tony Gavin's put a lot of hard work into this. I'd love to be in Liverpool having a bit of crack, and any American guests watching, that isn't that sort of crack. Liverpool's a great city. I'd hope to be there. but that's not happening this weekend.
Right.
So it's online, great resource. I just can't remember the name of the lady's practice. Go on TikTok, you'll find her. The same way, I don't know whether the Purple Potty Pod's on TikTok, but she has been on social media. She's built a practice off of that. Find a niche. Yeah. Here's your new broadcast studio.
Yes.
Say hello to the world. People worry about what they're going to talk about. Did we plan what we were going to talk about?
No.
So, yeah, just talk about, I said before, you're worried about what you're talking about to a patient. Just pretend your favourite aunt phones you up from holiday or from wherever she lives. She can't get to see you and she wants to have a chat about her foot problem.
Mm-hmm. That's really good.
Talk to her like you talk to your aunt. Don't complicate it. Don't use any Latin. Don't use any Latin, please. She doesn't need to know the origin of her perineum brevis or something. She's not interested. All she wants to know is, can you make it feel a bit better?
Yeah.
I can't. Great. And again, especially now with lockdown. Again, if you haven't, sorry, shouldn't be so. This is it's coming again. It's going to lock down again. Now's the time to start phoning your patients to prepare them for that, to talk to them about how they're going to manage their foot problems over the next 4 weeks. What they can be doing, a little bit of exercise or falls and balance stuff to help them when they're not going to be as active and mobile.
Yep.
Because people are worried about is they're going to lose out on their activity and mobility, their independence. They're worried about surgery. They're worried about taking long-term medication, and they're worried about their general health. Guess what? We work in the healthcare business. But you got to talk to them about their health. Not about the machine in the corner of the room that goes bing. Yeah, because that's what people do. They think, well, let's go and buy this.
Yeah.
You can do it that way. You can market around a particular treatment modality that you use or a special bit of equipment. I used to do that with foot scans all the time. Yeah, give patients the little color printed out things to take away with them. And what does that mean? Don't know. Throw it in the bin. They spend 2 hours, 3 hours assessing and diagnosing and treating patients. The whole, even I was confused at the end of those appointments. And it's keep it really short and simple. Simple terms. It's a bit stuck. It needs to move more. Okay. It's moving too much in the wrong way. Let's change that.
Yeah.
Everybody understands that.
Yeah, that's good advice.
You used to explain it like a watch mechanism. The cogs aren't meshing properly. It's a bit stuck, and that's why it's jammed. It's like a stiff, your joint's like a stiff door hinge. It's not moving. Here you go. You got a full range of movement in a joint. Yeah. You got no movement in a joint. There's no problem. With me, with my no elbows now. But if you've got restricted movement in a joint and the joint needs trying to force through there, then you're going to get pain. So what you either do is block it, stop the movement, then stop using the hinge on the door, or else you put a bit of oil on it and get it moving again and free it up. What do you want? Yes, I know I would get patients. One of the ones, she was very affected. I related it to her. She was a piano teacher. I was saying, when she arrived late again, hadn't done them, was all drama. Just before we go home with this late appointment today that you're up my whole schedule with, what happens when your students turn up to your piano lessons late and they haven't done their practice? Oh, yeah, well, I know. Got rid of her 2 weeks later when she turned up again late, like an hour late. And while I was leaving, insisting I have to be seen. Hold on a second. You want me to be late for a meeting because you want to keep me late because you were... No. Tell you what, just give Breed a ring. You'll reschedule the appointment. And then I phoned Breed and said, when she phones, tell her I'll give her a ring. So I phoned her when she phoned to make the appointment on the Monday or Tuesday and told her she was getting no more appointments. I wasn't being nasty. She screwed up the whole dance 2 or 3 times and then was like, insisted on being seen by being lit. What do you mean? Clear off. I want some, everybody has their list today that will look down and go, oh, Jesus, he's coming in again. That guy, that woman.
Yeah.
I don't want those. You want your AB patients. You don't want your CD patients. Jonathan Small talks about that all the time. And it's also the 80-20 rule of business. You know what the 80-20 rule is, Ektaa?
No.
20% of your patients bring you 80% of your business. 20% of your patients bring you 80% of the money into your practice.
Right.
So just let's focus on those 20%. So that person who complains about the prices can, down the road, because you can get it cheaper, mate. That person who doesn't want to turn up and do their, these people are going, yeah, well, that's what I want. That's what I need. I'm going to do this and we're going to do that. And you plan it and you scan them, you x-ray them, and you put all this protocol in. And then they don't turn up.
Yeah.
You didn't really want it then, did you? No. Not now. Maybe not now. So, yeah. But again, it's, so get rid of them. Why not? Go to somebody else's problem. I don't want pains in the ass. I want somebody who wants to, who's proactive and wants to get better. And go on the journey together. Yeah, that piano teacher couldn't fathom that turning up late and not having done her exercises or done any stuff after for 2 weeks was the same as one of her piano students turning up and not having done any practice and turning up 20 minutes late for the 4th time and insisting on and making everybody else late. See ya. Yeah. But people are in this scarcity mentality, have to see everybody and have to do the shit work and have to go out and do a nursing home and cripple yourself and have to get paid bugger all. Yeah, don't have to do that. There's a lot better way of doing things. You want to find out how, just let me know. Because I'll be talking about this for months and months and months. And it's all going to be coming around again. Because those practices who didn't put in those business fundamentals the first time round and didn't upgrade and didn't get onto a computer system and have started an email list and a text reminders and all those sort of fun things that are really, really simple to implement in a couple of days or a couple of weeks. They're now going to go into lockdown again without any of this. Mm-hmm. So the patient who you've seen this week, you said you're going to do X, Y, and Z, or get them back in, or cast them, or do PRP, or put them on an exercise program, or reconstruct their nail, or do whatever. They need a phone call on Monday to go, shit, yes, we're all closed down again. But here's the top 3 things you need to do, or could be doing in lockdown to help that before we see you again. And then phone them 2-3 weeks later. Go, how are you going? Yeah. Just cancel their appointment today for next week and never speak to them until a month's time or 6 weeks' time or whenever we're going to get out of this shit show. So there's one guy down in Dublin, spoke about this yesterday. He took that attitude. I spoke to him. But there was no help. I started talking to him in July and he hadn't spoken to any of his patients that he'd cancelled since March. Well, you for real? You all those patients, you just cancelled it. That was it. Haven't heard from you for 12 weeks. Yeah. Guess what? All those patients started going other places. He was trying to sell his practice. Then he couldn't. All those patients just went poof, evaporated. Yeah.
Of course, you need to be proactive.
Well, yeah, people are thinking the bean do you want, so they're going to come again. Certain people will, but a lot of people won't. Yeah. So if you want to learn how to be the go-to podiatrist in your area, check me out. We're doing a course about it, how to do that. Some business fundamentals, some biomechanics stuff, how to progress it. I'll just explain it. When we were training the students who came from Galway, mainly, it was like the dentist. Do you want to go and see the dentist who goes, not too sure. I'll tell you what, we'll see you in 2 weeks. We'll try this. We'll see you in 2 weeks. We'll see how it goes. Give me a ring. Have you ever had a dental conversation like that, Ektaa? I haven't.
Nope.
I've had a dental conversation which is like this is what's happening. This is what you've asked to do. We're going to do this. We're going to do that. We're going to drill that. We're going to pop that in there. We're going to make it really painful for half an hour, inject, and we're going to implant this, and we're going to do this. It's going to cost you however many thousand, and it's going to take 12 years. This next Tuesday at 2:30 suit, and here's our payment package on the way out.
Yeah.
That's what dentists do.
Yeah.
I want to go and see that person. They know what it is. They've made a working diagnosis. Here's the program. This is the baby steps we need to get there. Are you coming? I am. Cool. Let's go. Yeah, that's the person you want to be working with. And that's how you need to explain it to them. We're not taught that. We're not taught that. We're taught treatment. And again, it's the course is trot around. The course was set up initially so you'd qualify and go and sit in a health service job for 40 years and just do health service stuff. But those jobs aren't there anymore, and the world has changed. You can't put your ad in the golden pages and put your plaque on the wall, and you're the only podiatrist or chiropodist in your town, and everybody knows you.
Yeah.
Yeah. So
you have to change. If it changes, then you have to change along with it for sure.
Yeah. And people want to say they want to build a practice by word of mouth. Yeah, that's great. Loads of people take 10, 12, 15 years to build a practice word of mouth. I built a £1 million turnover or $1 million turnover in like 4 years. Yeah, you can do it the long way, or you can do it quickly. I'd rather do it quickly.
Yep.
Because it allows you to do lots of other things. Say you want to work for, you don't want to be working for the practice needs to work for you to give you a certain level of income so you can look after yourself and your family and take time off and do courses and be able to buy the latest equipment and service yourself better first, so you're better then ethically able to serve your patients better.
Definitely, yeah. Yeah.
So they don't teach you any of this at podiatry school. You've seen your mum do all this. I'm sure she ran practices really badly when she first qualified, like I did. And it took her a while to work it out because there isn't any explanation. There isn't any. But now we've got the go-to podiatrist course. You'll be able to find out how to do it. Because it's a great career. And the really sad thing is about the number of people who do a couple of years qualified and then they get a bit confused and they don't really see a career pathway in it, and then they'll go off and retrain something else. Yeah. Maybe it's that or the scary diabetic pictures that get shown on the first day. Apparently one guy in Galway didn't turn back up the next day. That was it. As soon as they put up the first diabetic poster, he didn't turn up in the afternoon.
Oops.
Well, better early than late.
Yeah, that's true.
So it's a great career. It's given me, a lot of colleagues, it's been great. It still continues on. If ski season opens up, we'll be in France. You can come and see me in France and get your footbeds fitted. That's the plan, but it's not looking good for the ski season, is it?
Not at the moment.
The Canadian government have advised people that they shouldn't be making plans for travelling to be snowbirds this winter. They're not advising against travel to Florida and California and places. So Uncle Barney and Auntie Anne aren't going to get to go. They live in Vancouver Island now. They're not going to get to go to Florida this year. Well, that's the Canadian government advice at the moment. So anyway, any more questions?
That is all from me today, sir.
I thought it was going to be, at least didn't get me to wear a stupid wig or anything like that. I'll get back to, what are you doing for the rest of the day? What's the weekend plan? Studying hard in your job. Yep. Well, I'm sailing tomorrow. I might go for a swim now, but I'm definitely going to wear a wetsuit because it was absolutely freezing yesterday. The water temperature was 12 degrees. But it helps with my leg rehab. So I played 2 hours tennis this morning.